Good evening and welcome to our third League of Women Voters Davis Area Health Forum. My name is Michelle Famula, and once again, I will be the host for this evening. Tonight, we offer our third forum presentation entitled The Future of California State-Based Health Reform. We're honored to have with us this evening two distinguished experts in the area of healthcare system reform. We'll begin our forum with a presentation by Dr. William Hsiao and follow with a perspective by Ms. Cindy Young. We'll then provide facilitated discussion specifically focused on the future of California state-based health reform and conclude this evening's forum with audience-submitted questions. This forum is being recorded and streamed on YouTube Live. Our League Healthcare Committee has selected the speakers, developed the format, and authored the moderated questions for tonight's forum. Our webinar host will receive your audience questions throughout the discussion. Please submit your questions directly to the host using the chat function at the bottom of your Zoom screen. Tonight's presentation is intended to help voters better understand California's health reform options and appreciate the impacts of both state and national legislative and executive leadership initiatives. If you are new to our forum series, we welcome you to visit our League website at LWVDA.org to view our two prior forums. Tonight, two highly respected experts, William Hsiao, Professor Emeritus of Economics, Harvard T.H. Chan School of Public Health, and Cindy Young, President of Healthy California Now, will better acquaint us with the opportunities for California state-based health reform. For this evening's format, we'll begin with Dr. Hsiao's presentation titled The Future of California Health Reform, Which Pathway Forward? This will be followed by Ms. Young's commentary and perspective based on her many years of experience in the California health reform movement. Our speakers will then consider two moderated discussion questions they've received in advance and follow up with your audience questions. In conclusion, we welcome each speaker to provide a closing statement on how voters can improve their understanding of state-based reform and how they can best engage to address their health policy concerns. Now it is my great pleasure to introduce Dr. William Hsiao, Professor Emeritus, T.H. Chan School of Public Health, Harvard University. Professor Hsiao holds a PhD in economics from Harvard and is also a fully qualified actuary with extensive experience in private and social insurance. He's served as a consultant to the White House and Congress. Dr. Hsiao, whose health economic policy research spans across developed and less developed nations, is a leading global expert in universal health insurance, which he has studied for more than 40 years. Welcome, Bill Hsiao.
Thank you. Good evening, everyone. I want to thank you, Michelle, for the organized this event and also just gave the introduction. I'm happy and honored to give this talk, informal talk, to the League of Women Voters because I admire and support what you do. You educate the public to pursue actions to advance the common good and the well-being of everyone. And so I'm honored to be a part of this evening. The message I like to present in the next 18 minutes or so will be about what problems does the United States have in healthcare? And how would a single payer system solve our major problems? But then to do so, to adopt a single payer system, there are strong political oppositions from the current vested interest groups. So therefore, California voters and the policymakers have to make a choice. That's why I call it which pathway. So I'd like to then begin my presentation then, just first outline what are the major problems in California today. All of you are familiar with the uninsured, underinsured problems, so I will not waste your time on. But I would argue California, like United States, we have a rotten health system structure foundation. That foundation is wasteful, high priced. There are fraud and abuse in billing for claims, and make our healthcare high cost, the foremost and the highest one in the world among all the advanced nations. And it's questionable how long we can sustain the current system in the long run. Then the third problem is some Americans, particularly in California, in the central California, you have many people do not have access to high quality care because there's a shortage of providers. Even if they have insurance, they could not really get health care. This picture here is what I'm trying to illustrate what the United States have done. We have an old house. The structure has been weakened, and the wooden structure beams has been corroded by termites, and some of the beams are falling down. But what we have been doing is we put another structure on top of it, make it even heavier. That's Medicare and Medicaid. Then most recently, we put the Affordable Care Act on top of it. So the question is, do we want actually to do something with the fundamental structure, or we're going to just pile more, I call Band-Aid solution on? So in this slide, I like to just summarize how a single payer system will solve the three major problems I have just outlined. For the uninsured and underinsured, which California has roughly 3.5 million people, single payer says, if you're a resident, you're automatically covered. In other words, universal coverage, and everyone is covered with the same benefit package. In other words, equitable. Right now, our health insurance coverage vary widely. Some people have very good coverage, some people have very poor coverage. The major problem, as I showed in the previous pictures, we really have a rotten structure which creates waste and abuse. In a single payer, we will remove the multiple insurance plans, which creates complex or administrative procedures and work for our hospitals, doctors, nursing homes, podiatrists, and so forth. We have multiple types of patient records and claim records. So we do not have a consolidated record for practitioners to exchange information about the patient to give them continuity of care. And we don't have a uniform claim record we can monitor not only the healthcare, but who actually commit fraud and abuse. This is what we learned in other countries. Actually, let's say in Taiwan, they discovered when they introduced a single payer system, there were 8 to 10% of fraud and abuse. By the way, that's what FBI pronounced more than 10 years ago. There are 8 to 10% of fraud and abuse in billing in Medicare. How do we get rid of these abuses? Well, single payers do it through a uniform claim record. So you have a profile of every practitioner. Then you can know who's overbilling, who is always trying to get the most reimbursement out of the insurance plan by overstating the severity of the patient or the complexity of the service they render. Then the single payer system solved the problem of lack of access and poor quality for many by using the savings to invest in services in the underserved areas, as well as create uniform clinical record to coordinate the healthcare and duplication. I think many of you already know this, but here I'm just giving you a brief summary. However, I like to point out, if you go to a single payer, then how much can you save? We're right now in California. Every resident in California, on average, spends close to $11,000 every year for healthcare. That comes out from your pay, that comes from the taxes you pay, that comes out from your out-of-pocket. If you move to a single payer system, you will have a collective negotiation with drug and medical suppliers for their prices. United States, on average, pays 2 to 3 times for exactly the same drug that's sold in Europe, like in Germany, England, France. We pay 2 to 3 times. That's because we do not negotiate with pharmaceutical companies. If we have negotiated prices, it's estimated we can at least produce a 5% savings. Here I want to remind you, every 1% of savings in California means $4 billion every year. 1% equals $4 billion. So keep that in mind. Then if we have one single essential benefit package and uniform claim record procedure, that will reduce administrative expenses for our providers, as well as reduce administrative and profits of insurers. We could save 6 to 12%. This wide range is because I have not, and others have not done really a careful update of these figures yet. That's why I give you the wide range. The minimum also the maximum percentage you can save. Then if you consolidate the claim record into one uniform, you reduce the abuse of fraud in claim filing. That would save California 6 to 8%. Lastly is when you create a uniform electronic record, you reduce the redundancy of the services among the providers, as well as improve the quality of care and the outcome for the patient. That could save you 3 to 5%. If you add up these major interventions or reforms you do, California can save 20 to 30% of its current health spending. 20%, let me just then, equals to $80 billion for California every year. Look what you can buy for your own family, or if the state saves that money, what the state can do to support education, social welfare programs, and even your high-speed train between San Francisco and Los Angeles. That's what it means. So then let me go to, well, that sounds like a dream. Why don't we pursue it? Well, the reality is, in the United States, we have already built up powerful stakeholders. But it's more than that. Like the most recent election, you see American people, some of them hold on to strong ideology. Like some people believe the government should not interfere with the marketplace. The government should stay out of the way. And those are called libertarians. So if you create a single payer system through the government, these people will most likely oppose you. How do you convince them that? Then I mentioned about the powerful vested interest groups. You know them, they are private insurance companies and pharmaceutical companies, as well as your hospitals, because they worry the price paid to them could be reduced. And also, California has a booming internet.com company. Those are young companies employ young workers. Their health insurance premiums are very low. And their employers pay also low premium for their workers. These companies under social insurance single payer system will have to pay higher premiums to cover for all the Californians. When President Trump tried to introduce his health reform in 1992, I know behind the scenes, the California.com companies at that time, silently but behind the scenes, opposed it. These are powerful and wealthy stakeholders. Private insurance companies and pharmaceutical companies in California get somewhere close to about 150, 160 billion dollars in revenue every year. If they just put up 1% of their annual revenue for 1 year to oppose you, that's $1.6 billion. Think of how many TV ads they can do. How many political campaigns can they support for candidates running for office? And then they can get these candidates to promise, if you are elected, you're going to oppose a single-payer system. They're not trivial, these opponents. But then another one. Yes, in California, when you do a public survey, you have always consistently nearly 75% of people say, I support the single-payer system. But as soon as you tell them, are you willing to pay higher taxes for it? That drops down to the 40%. People don't understand, I may have to pay higher taxes, but I start paying out of various pockets I'm paying out now for healthcare. That's including the premiums I pay, my employer pay, taxes to local government, to state government, and the out-of-pocket costs. People don't understand that yet. And they need to be educated by League of Women Voters. Then last difficulty is to do a single payer in California, you need federal exemptions for Medicare and Medicaid laws, and also another one which is called a law that say about the employers and employees have freedom to choose what kind of health insurance plan they offer to the workers. Then, of course, with the most recent event in our nation, you can expect all sorts of political court challenges will happen. And the vested interest groups will bring these suits. And even HCA right now are in the courts. This is after almost 10 years of its passage. So I don't want to be pessimistic, but I think we need to be realistic. This is a picture I gave to my class. I showed, here's a person who would like to climb the mountaintop up here. He has to go down to a ravine, a river there. There are crocodiles there. He has to cross that. He has to climb the mountain, go up snow slope. Yes, he would like to reach that mountaintop, but there are barriers. That's what I want to, at this picture to illustrate. So then let me come to my last slide. In my view then, California has 3 pathways Californians and your policymakers have to choose. One is I call Band-Aid solution. That's what the United States have been doing. And that's what President Biden said he would support, which is to add a public option to Accountable Care Act or the Obamacare. That's a Band-Aid solution. California already, among your 3.5 million people, uninsured. 70% of those uninsured can get health insurance, but for one reason or another, they decide not to enroll. Either because they don't know about it, or they are unable to afford what they have to pay, or they're unwilling to pay. In my lifetime experience, young people between age 21 to 35, large portion of them think I'm healthy. I don't want to pay anything for health insurance. So you can go ahead and add in a public option. I'm confident to say you're still going to have about somewhere 3 to 5% of Californians say, I don't want to join unless you pay my premium. That's one option. I call the Band-Aid solution. Add something else on that collapsing building, which I showed earlier. The second option you have is what I call transitional reform. You incrementally move towards a single payer system by putting the necessary building blocks. Yes, you expand ACA coverage, including possibly the public option, but you have to give additional subsidy to people to buy it. But you have to combine it with, for example, for California to establish a purchaser alliance between all the hospitals or between hospitals and insurance companies to bargain with pharmaceutical companies and medical supply companies for reasonable prices. You use the purchasing power to bargain for reasonable prices. Another one is to require hospitals and clinics to conduct cost accounting. That method has been established 50 years ago. But hospitals may or may not do cost accounting, and then they set their prices. Then they tell you, oh, look at the big discount I give you. But maybe they don't give you any discount. You don't know the truth. We should require all these bigger organized providers to conduct cost accounting and make them transparent. So you and I can judge, are they making too much of profit or they're asking for a reasonable price. Another one is what I said earlier, is to establish uniform electronic clinical claim record to monitor the abuse and fraud, and also to coordinate health care for the patient. That, by the way, technically is feasible. Other countries have, European countries, Taiwan, and Canada have already done it. So it's a no-brainer. Then last but not least is to educate the public about the shifting of cost financing to one source, which may be taxes, but they're going to actually spend less in total from paying out from different pockets. That would be the transitional reform option. The last one is I called, and others people also called, one great leap. That is, we just go for single payer. I would say if that can be done politically, sure, that's the most expedient and desirable way. But then the question is how you're going to mobilize the political support to overcome what I listed earlier, the powerful opposition as well as the ideological opposition. So let me say the last word. The message I'd like to have you take home is this. We, the United States and California, have a rotten healthcare system structure. We have more than just the problem of uninsured and underinsured. I know that has captured the political attention, but our fundamental problem is much bigger than that. We're wasting roughly, academic studies documented for 20 years, we're wasting 30% of what we spend for healthcare, for administration, for unnecessary services, for redundancy, for billing fraud and abuses. So then the question I like to then have you ask, once you understand we have more than a problem of uninsured and underinsured, do you want a Band-Aid solution? Or do you want a transitional solution? Or one great leap forward? Thank you.
Thank you, Bill, for that wonderful presentation. If you could unshare, I would now like to take this opportunity to introduce Ms. Cindy Young, President of Healthy California Now, to offer her reflections and perspective on California's health reform leadership opportunity. Ms. Young leads a coalition of organizations founded on the principle that healthcare is a right and that publicly financed healthcare is critical to our state's social and economic well-being. Ms. Young holds a BA in Labor Studies from San Francisco State University and began her career as Director of Research at HERE Union Local 2 in San Francisco in 1985. She has served as the Senior Health Policy Advisor to the California School Employees Association, providing counsel on employee health insurance, and as a Regulatory and Policy Specialist for the California Nurses Association, advising on healthcare policy and health reform. Welcome, Cindy Young.
Well, thank you so much, Michelle, and thank you very much to the League of Women Voters for inviting us here. Our state is at a critical juncture, and the League of Women Voters, providing these panels and forums, a series of them, to help inform voters of the choices that they're going to have to make is critical. So thank you for having me, and thanks for allowing us to talk about this really important topic. So I'm going to tell you a little bit about Healthy California Now, but I just want to say that for almost 15 years, there has been a solid group of organizations that have come together to make California the first state in the nation to implement a single payer system. And it's had other names and been other things and had a formal structure and not had a formal structure, but there is a solid group of very strong activists. And now we have come together as Healthy California Now because we want to be the first state in the nation and lead the way to show what a state-based single-payer system can do. Social justice movements in the U.S. Percolate and grow at the state level, and we learned this, by many lessons, but certainly the most recent lesson around marriage equity. That's percolated at the state level and grew strategically. It was, there was a strategic coalition throughout the country that were built, and then ultimately that became the law of the land. So that's really who we are in the group that that is trying to lead this effort for a state-based single-payer system. So the Healthy California Commission was established through legislation in 2019. And it was to develop a plan, a healthcare delivery system that provides coverage access through a unified financing system, including but not limited to a single payer financing system. And the commission is to provide an initial report to the governor and legislature by 2020 and a final report by February 2021. And then lo and behold, you know, we ended up in this COVID situation, and I think it's just thrown everybody's timing off. But the commission most recently released an analysis of healthcare delivery coverage and financing in California, often referred to as the environmental report. And the commission is right now on hiatus until the first of the year. I think probably the Department of Healthcare Services is, you know, overwhelmed at this point in time. But you know, we absolutely have to keep this commission on task and keep it honest to the people of California. And I think that's one of our most important jobs. So we had to respond. Comments had to be in a few weeks ago, you know, to respond to the environmental analysis. So, you know, I would say we are so dissatisfied with that environmental analysis because it missed so many key points around our healthcare system. COVID-19 has shined a bright light on the deficiencies of our healthcare system, and millions of workers, you know, are now unemployed and no longer have coverage. No other modern nation in the world puts the burden of providing health insurance on the back of its employers. And I'll just share a very personal story with you. You know, my daughter got laid off last March because she worked in the tech industry. She was laid off, and at the same time she was given a pink slip, she was given a COBRA notice. So you can imagine, you know, living in the Bay Area with the exorbitant cost of living, losing your job, even with the bump in unemployment benefits, and then getting this exorbitant bill so that you could continue to have healthcare coverage. And the only way that you could get covered otherwise then would be at some federal poverty level that allows you to get subsidies or ultimately allows you to get care through the Medi-Cal or Medicaid system. That is absolutely the most ridiculous way to provide health care to people in this country, and certainly people in this state. So our healthcare system is not equipped to handle the patient need before COVID-19, as access to primary care is a huge problem in California. I still do a little bit of work in rural counties in California, and you know, every year we see the cost of health insurance going up because people are using the emergency room for primary care because they can't get, it's not that, you know, this whole notion that people are overutilizing or going to the emergency room because they're misusing our healthcare system is ridiculous. There's no access to primary care. There isn't enough primary care physicians because we have no health planning in this state or in this country. So we're not building clinics, and I'll touch on this a little bit more later, but we're not building clinics where they need to be built. So, you know, people that need care either are waiting until they really get sick, or they're accessing emergency care, which is not where they should be getting primary care, as a way to, you know, to get well. Even as we hope to see a vaccine on the horizon, you know, we're now going to see all the profiteers lining up to, whoops, I just lost my, there we go. Lining up to, you know, to try to make, you know, billions of dollars for their shareholders on, you know, on this vaccine. So this is not the way that we should be delivering healthcare to our, whoops, whoops. Okay, there we go. So I think.
Cindy, you are not sharing your screen, so I started sharing mine. Would you like to control over?
Yeah.
Okay. If you just hit sharing screen on the bottom.
Whoops,
We're
I
just
just
listening
did.
to you talk.
Okay, thank you. Okay. So is it showing up now? Can I see it?
Not yet.
Okay. I wonder what's up here. Let me just see. Okay, is it coming in now?
I'm
'Cause
not,
it's
no.
If you like, we can share your slides and you can just say next
Okay,
slide.
that's
Yeah,
great.
let's
So
do
we
that.
should be on our response to the environmental analysis. Are
Right.
we there?
I
Right,
am
okay.
pulling them up now. So for some reason there we go. Response to, perfect.
Okay, so so I just, you know, let me just move this out of the way so I can see where we're at here, right? So you know, there were all the problems that we saw with the pandemic, you know, that's approached us. Millions of workers are unemployed and no longer have coverage. Our healthcare system was not equipped to handle the patient need before COVID, and certainly this has shed a light on it. You know, the for-profit system could not allocate, you know, or procure the necessary medical supplies. Nurses, essential healthcare workers don't have PPE that they should have. You know, people are dying. You know, healthcare workers are dying because they're getting COVID. It's just, this crisis has brought all of the deficiencies in our healthcare system to light and makes our action even more important now and more urgent. There is more of an urgency to do something. So next slide, please. Out.
Yes.
We can go to the next one. So this is like one of my healthcare heroes, Willie Reinhardt, and I think that Dr. Hsiao probably has worked with him in the past. He recently passed away, but he did a policy paper in health affairs in 2003, and it was called "It's the Price is Stupid: Why the United States is So Different from Other Countries." And the consultants to the Healthy California Commission, who are receiving $5 million in remuneration, in my opinion, missed the point, which is that it's the price is stupid. Our healthcare system is ridiculously expensive. And they did not put down the savings that single payer would save this state. If we have, you know, in the environmental report, they missed that key fact. This is ridiculous, in my opinion and in our opinion, for them to miss something so important as the savings under a unified financing system. They did a lot of delivery system reform if they tinkered around the system, but they missed that key fact. And we have got to get them to, we need to put pressure on the commission to get them to begin to document the savings of single payer, because it's one of the things that Dr. Hsiao showed us and shared with us is we don't have a policy problem, we have a political problem, right? The slide that he showed with that gentleman trying to walk across the river and get to the top of the mountain is a political problem. It's not a policy problem. And if we can't have the facts down of what a single payer system does or doesn't do, right? Just in all honesty, then the people of California cannot make an honest decision about what's right for their future around a healthcare system. So next slide, Famula, if we could. So when SB 562, which was a California single payer bill a few years ago that the legislature debated, when it was being debated in the legislature, Robert Pollin, a professor of economics at the University of Massachusetts at Emeritus and a founding co-director of its political economy and research department, developed economic modeling for California's single payer system. And here's in a nutshell, I mean, I just pulled the study out and pulled out some important facts about that, right? But you can see just by looking at this that California would save millions of dollars, right, if it had a single payer system. So even, you know, economists will tell you if you provide healthcare to everybody in the state, you're going to have increased utilization because people that had not had access to care will have access to care, so that will increase utilization, or people that are underinsured, people that have high deductible plans, for example, that may not use their health insurance because it costs them so much up front to pay for services that they don't do that. Once they get health insurance, there's going to be increased utilization. But even with all of that, there would still be an 8% projected net cost savings, even after the increase in utilization. So the cost savings really comes from streamlined administration, which Dr. Hsiao talked about, drug pricing, negotiating those drug prices, a fee structure for providers, and then reduce fraud and waste and abuse that Dr. Hsiao mentioned in his talk earlier. So, you know, there is data out there that the consultants could use as a way to begin to have a dialogue with the people of California. And that's what's missing. If we don't have the facts, if the commission does not give the people of California the facts to make a decision, then all they're going to get is a bunch of rhetoric from the medical industrial complex, the evildoers, that I'll call them evildoers anyway, that Dr. Hsiao talked about either. The interest, the financial interest that will absolutely oppose anything like this happening. So we have to hold those commissioners and those consultants accountable for not disclosing information. And, you know, once people have all of the information, the people of California may make another decision, right? I'm not gonna say, I mean, I certainly have an opinion about this, but I think that not providing people with honest information for them to make a decision is a disservice. And we paid $5 million taxpayer dollars to get a report that is lacking in key facts. So next slide. So I just wanted to say this on a broader schedule, on a broader basis, is that, you know, every study that's ever been done on single payer really concludes 4 things. And you could go around in circles and read a bazillion different studies. And what you can draw out of that is there's 4 key facts about single payer. It insures everyone. It improves healthcare outcomes or quality. It saves lives, and it saves money. And that is the most simple messaging that I can think of. And you could argue, is it 8%? Is it 4%? Is it 16%? You know, is it, you know, around the savings? I really just think our messaging has to be very simple. And there are going to be some people who want to get in the weeds about this, but really these 4 key issues are, you know, what we need to stick to and stick by to help people of California understand what's in front of them. So next slide, we went back 1 slide, Camille, could we go to the next slide and then the one after that? Are we stuck?
Sorry, Cindy. Is it this one?
We just need to get to the, there we go. Oh, great, there it is.
Okay.
So I just focused on is delivery system reform. And delivery system, so this is, I guess this is the benefits of turning 65, is you get to see all of these silly things that people have tried over the years that have absolutely failed. So I have lived through this decades of delivery system reform, right? And, you know, in the 80s, we started these PPOs and, you know, exclusive provider organizations, and that was going to save us bazillions of dollars and save employers money, and employees would have more choice, right? And then we went into this consolidation of insurance plans and paying providers for performance, right? Because if we could, you know, get them to perform, then it would increase quality and reduce the cost of care. In 2003, the Institute of Medicine came out to err is human, with a, you know, that said, I think, you know, 100,000 people die every year due to medical errors. And the focus was on quality and a fiduciary responsibility to shareholders. Then You know, on the insurance plans, absolutely went haywire. And in California, we went from not-for-profit to for-profit insurance systems. And those insurance companies then had to deliver profits to their shareholders because that was their obligation to do that. In 2010, we started treating patients as customers instead of and consumers instead of patients. Every time I read something that says, you know, the consumers of healthcare, I think these are patients that are seeking care because they're sick. They're not consumers. This notion that, you know, someone can go out and make a choice about insurance. First of all, if the physician or a provider is not on your network, you don't get to choose. Your insurance company has already made that choice for you. And I don't know one sick cancer patient or a sick person that is, you know, making a choice as a consumer, like I would purchase a cell phone or, you know, a pair of shoes. It is a misnomer that healthcare is a consumer good. It's a human right. And now in 2013, we started accountable care organizations with the Affordable Health Care Act, and you know, hospital corporations are bought up all the physicians now. All the physicians are now hospital employees, and we are still dealing with provider consolidation. So much so that the Attorney General of California sued, right, a big hospital corporation in Sacramento called Sutter Health for its practices of consolidation and how they priced. So the free market and this delivery system reform is not going to resolve our problems. It never has, and it never will. So next slide. So I just, you know, I want to say that this market continues to drive consolidation. I'm seeing more and more hospitals and providers get eaten up by larger corporations. The employer-based healthcare system is crumbling. I can't think of one school district that I work with, and I work with several in California, that do not have a defined contribution health plan. So that means that the employer's contribution is capped and all of the increases are on the backs of the employees, which leads to absolutely disintegrating the standard of living for those workers. Because as rent and milk and cost of college and cost of clothing, cost of gasoline is going up, every ounce of money that they can get out of their employers is then going to fund the cost increases in healthcare. I was just looking up here. I wanted to be sure I had this correctly. I was just looking at CalMatters this evening, and they are projecting that the post-retirement medical liability that employers must now list on their financial statements for California is $147 billion. That is creating downward pressure for employers to cap retiree medical costs after people retire. It's making people work longer because they can't afford health insurance, and it's costing the state millions of dollars or billions of dollars. If we had a single payer system, all of those costs would be wrapped into the cost of providing care for everybody in our state. And narrow networks are reducing patient options for care. I could tell you a bazillion horror stories about narrow networks and employees in rural communities having to drive 50, 60, 100 miles to get radiological benefits. Declination of care. If you just went to the Department of Managed Healthcare in California and looked at the complaints against California's HMOs, you would see that the declination of care around what the providers do to prevent people from getting the care that they need is horrific. And then provider profit center expansion. There's a lot of discussion about health disparities now, and I don't believe that we'll ever resolve the health disparity issue until we have control of regional planning for health facilities, because right now what we're seeing is hospital buildings in upper income neighborhoods, and in lower income neighborhoods where they need primary care, there aren't clinics being built. And so you see this huge economic disparity in access to care. So, you know, if you go to Monterey, there's a hospital that has a koi pond and valet parking, and you go to, you know, places in inner cities where folks have to get on a bus and go for miles to get access to primary care. So single payer would resolve that issue for us. Everybody, you know, you would have someone doing regional planning and building clinics and hospitals where they're needed, and not because insurers see an opportunity to get greater insurance dollars out of the public. So next slide. So I just love this guy. He always made me laugh. And, you know, he said, and this is absolutely true about our healthcare system, right? I don't believe that there's any problem in this country, no matter how tough it is, that Americans, when they roll up their sleeves, that we just can't completely ignore. And we have put our head in the sand about healthcare for years. I think that it is at it's at a pace now where people are really being harmed by these high deductible plans and lack of access to quality care. It's really time for us to roll up our sleeves and get to work on this issue. So next slide. So I just want to say lessons from the election, right? There has been a lot of pushback from certain political parties saying that if we, you know, that if it was too progressive of agenda, and this is why we lost, you know, certain candidates in this election. And the fact of the matter is that every candidate that stood up for Medicare for All was reelected. And it was the wishy-washy candidates that didn't get elected, because people want a clear vision for our country. And people want this issue resolved. So I think when I talk to people, and if I talk to them, you know, not in policy speak, but in regular speak, right? That they understand this healthcare issue around being not, I believe healthcare is a human right, but that everyone should have access, much like we have a publicly funded police department to keep us safe. We have a publicly funded fire department to protect us from fire, right? If my neighbor's house is on fire, my house is in danger of catching fire. And that's why we have the fire station on Arlington in my community, is to protect us all. We have publicly funded schools to educate all of our children, and we have a publicly funded military to keep all Americans safe. So why don't we have a publicly funded healthcare system to keep all of us healthy? Right? Because when I'm not healthy and I'm sick, you're at risk. I'm not working, I'm not paying taxes, I'm not contributing. And even if none of those things happen, let's say I'm retired, everybody should have a right to get the care that they need when they need it. And I fundamentally think that people believe that if they're provided with the right information, and it's not a scare tactic. So next slide. So unless we act, here's what's next. Here comes the public option to complete with, see, it's back to this competition thing. People actually think there's competition in healthcare, and there is not. Here comes the public option to compete with the private insurers. Politicians will tell us that it will drive down prices because the public option will be the government plan to compete with those private sector plans. But since we all know there's no competition in healthcare, the very smart actuaries will figure out how to avoid taking on the risk in the private insurance plans, which means treating sick, expensive patients, right? They will try to shed risk. That's the term that they will use. And really what that means is we aren't going to have the most expensive sick people in our insurance plan, and they will figure out how to avoid insuring them. They're very good at that. And then you've got the public option, which will have to take everybody. And if you're sick, you'll get into the public plan. And then what happens? The public insurance plan begins to be very, very expensive. And then it will have to start doing the same cutthroat tactics that the private market does to keep the prices down. This is a bad idea. We may have to go there, and if we do, it will be on my slide in 10 years that will say delivery system for reform has failed, public option in 2021, right? Didn't do the trick. So Medicare works because it covers all of us in one big risk pool. And if we had a single payer system, we would actually stabilize Medicare rates, because you would have all of those young and healthy people participating, bringing down the costs, because Medicare insures the most expensive population. People 65 or disabled that are eligible for Medicare are the most expensive population to treat, because the chassis gets a little rusty when you get older. Things start falling apart. You need to go to the doctor. So if we had everybody in one big risk pool and called it Medicare for all, it would actually stabilize Medicare. Because it works for everybody. So I just want to say that, you know, no more reference-based pricing. You know, this is another big popular term where the insurance company will say, you know, we're only going to pay the hospital X amount of dollars for that procedure because that's what it's worth. And if you use that hospital as a patient, you're going to be responsible for the rest of that bill. You to those facilities, you don't. And then I just said, you know, more EIEIO, more of this baloney that doesn't work. So next slide, please. So this is the, you know, you can actually see from this slide, it's from the Office of the Actuary from the CMS. You can see how much less expensive Medicare and Medicaid is than the private insurance company. And that's what we're talking about by a Medicare for all plan, or a single payer system for California, so we can lead the nation to a sane healthcare system. The price of Medicare, you know, is significantly less than the price of the private insurers. And if we could get everybody in this, this is where the savings comes from. So next slide. So what can you do, right? What do we do about this? We have to hold those commissioners accountable. Everybody that's on this Zoom tonight should send a, you know, a message, a letter, write a letter, send a message into that Healthy California Commission, and ask and let them know that, you know, that they did not model the savings for single payer in that environmental report, and that as a taxpayer, you want that done. And as a voter, you want that done. We need to have you join us and join Healthy California Now. I put our link here to get involved. We have to be stronger and better. And how there's been no social justice movement in our state or in our nation that has ever happened without a strong push from grassroots activists. So we ask that you join us, join our coalition, get involved. Governor Newsom ran on single payer. Right? He ran on that as a campaign promise. Go to his website and say, Governor Newsom, I'm counting on you to keep your campaign promise, and I'm watching what you're doing, right? And then over the years, what I found is that oftentimes our assembly and our senators, our state representatives, simply don't know what a single payer system is, to be quite honest with you. They've gotten a lot of education from the evildoers or from just their own experience, but they really don't understand how it works. And I would encourage you to gather yourselves as constituents in their assembly or Senate district and go in and say, I want you to know that the Healthy California Commission is meeting. They may or may not know that it is. And do you really understand the benefits of implementing this type of system, what it would do for us in the state of California? And if you would sign on, you could be a hero, right, for our state. You know, there's all the reasons why you should do this. So next slide. I think that's pretty close to the end. Yeah,
That is the end.
Yeah, it is the end. So thank you. Thanks very much. I think you know, I just think it's possible to do this. I've always believed that. I think it's possible to make it happen. It's just pushing at the right time to the right people. So, Bill, we're going to get across that river and up that mountain this time. So thank you so much.
Thank you so much, Cindy. So prior to this evening, our speakers were provided with 2 discussion questions, both of which I think Cindy has very effectively addressed for us. The League of Women Voters is looking for voter understanding and voter action. So I'll reiterate those questions we presented to our 2 speakers this evening. What do the California governor and legislators need to do to accomplish a unified financing system in California that is accessible, affordable, equitable, high quality, and universal? And what are the actions that California voters can be taking now to address these health policy concerns? And I think, Cindy, you articulated that quite well, and we'll give you another chance if you want to follow up with that. Bill, did you want to weigh in on those questions as well? I think you're muted. You're gonna need to unmute.
I said, go ahead, Cindy. You gave an excellent talk, and you summarized at the end what action people can take. You should go first.
Well, I just think, I guess this is my observation, is that when I have talked to senators and to assembly people, they don't even know that there's a Healthy California Commission. And I'm not even judging that. Right? You know, it's like, well, of course they should know about that. And then you think, well, you know, if my specialty is, you know, transportation, or my specialty is, you know, something else, why would they know that? And so as citizens, right, we can help them understand what the commission, you know, that the commission is meeting, and that the deficiency in that environmental report, I think, is absolutely the best next steps. But to get the Assembly and Senate to understand that. And then I absolutely think we have to put pressure on the commissioners. We need to write to them. We need to let them know that we know what they did. And you know, I don't know that it was intentional on the commissioner's part to omit the savings of single payer, but I certainly think it was an omission of the consultants. And so those commissioners have to hold those consultants' feet to the fire and say, hey, wait a second, you missed a key fact that is important for the California public to know. They may choose to vote for a single payer system, or they may choose not to, but they need to be provided with that information. And I think that's the best next steps.
I would just add 2 or 3 points. One, I think the commission can do a better job. And the environmental report, as you point out, did not really get behind the reasons why our prices are so high. And so I think, and here I think because I think the consultants really need more direction. And I think the public can actually help to direct what the commission, the consultants produce, which then is given to the commissioners to debate and discuss. What I'd like to add onto what you said, Cindy, is this. I study this health systems reform, which single payer is a major way to reform any nation's health system. I have not found a country that will reform their system for a single payer without the doctor's agreement to it. Unless that country has a revolution, okay? And so this is where I'm optimistic. Right now, 47%, 48% of the American doctors are employed now. The employed doctors actually support single payer because they found there's so much work, paperwork, not patient care work they have to do because the insurance system. And I think California particularly is a fertile ground to educate the doctors to support it. And when the majority of the doctors come into action, they can influence their patients. They also can, of course, they can speak with authority because they're medical specialists. And we have confidence in their views and we trust them. So that would be one suggestion I have. And because I worked in Vermont, and Vermont passed the single payer legislation, but did not implement it because people did not understand they have to pay higher taxes, but their total cost would be less. Not enough education was done on that part. But how did they initially pass legislation for single payer? That's because actually the physicians came out neutral. We did not even get a physician to come out positively, but they did not resist. If you look at all the efforts since 1930s and President Truman and so forth, the group that was most powerful, or at least what the textbooks tell us, is the physicians' opposition. And so that's one group I would suggest Healthy California Now may want to actually pay some attention to. And actually, I would not dismiss particularly small and medium-sized employers. If you study them, they found healthcare costs goes up more than the wages, not the wages, I mean, than the total economy. So let's say if they believe they can give their workers 4% total compensation increase, but health insurance part, let's say the increase is 5, 6, or 7%. You eat up that large portion of that total amount they can give. So the amount they can give for cash increase is much smaller. And workers will go on actually strike, spread out strike. My university, Harvard, went through that. And when you talk to medium-sized companies and small companies, CEOs, that's their annual headache. And they are behind the single payer system.
Thank you. So at this juncture, if we could, I'd like to see if we can also take a few audience questions. If you'd be willing, so much information up to now, but we will add a few more in. One audience member asks, how can we stop a takeover of independent providers and small hospitals in rural and underserved areas that's currently going on by giant corporation hospital chains and private equity firms? Do you have thoughts on this?
I have thoughts on that, Bill, and I would encourage you. And that's the only way that's going to get done is by legislation, is to have some type of, legislation that would prevent that from happening in rural communities. It's short of that. I don't know how you would stop this movement towards consolidation. Bill, do you have a better suggestion?
I don't. The hospitals, big hospitals, buying up small hospitals and solo practitioners as feeders to channel their patients to their hospitals. That's going on throughout the United States. And you will have to change the marketplace, the regulation on marketplace. That's probably is you have to actually control the monopoly that gets created through that effort. So you're right.
So another question from our attendees, and this was directed at Dr. Hsiao, but I would suggest something for both of you to consider. You mentioned, Dr. Hsiao, some steps that were listed in transitional reform. And the questioner asks, of those transitional steps as they get proposed, are any of them promising, or which among them would you consider to be the most promising?
I consider the most promising one is to form a purchase alliance, first to negotiate for drug prices. Here, the public and the nation, even, whole nation realize really the drug prices, many drug prices, particularly insulin, is used as an example. But there are hundreds of these examples. And I think legislators and the public are ready to support that. Then uniform records, that also is now with the technology, that also becomes very feasible. And it's a matter of education and convince the insurance companies and the providers, the doctors and hospitals, to go for a uniform record.
Cindy, did you have thoughts on that one as well?
Yeah, I was just trying to look up a piece of legislation that just recently passed that I think is hopeful, and that is the state is setting up itself to become the purchaser of generic drugs. And if that's done correctly, that will help. In my opinion, it's not going to resolve our broader issues, but I think that that would help. That anything that establishes more government oversight and more regulatory power to stop the abuses that happen, those are not bad things, in my opinion. Those are good things. It's not going to resolve the biggest problems that Bill and I talked about tonight, but those are things that can and should happen. If we can improve Medicaid or Medi-Cal in California, if we can find a way to provide providers more money to keep it from being privatized. Right now, our Medicaid, I think 70% of it is now privatized or turned over to HMOs to manage on behalf of the state of California. That needs to stop because that costs us more money. If we can pull that back and put more money into public health, like our community clinics, and make those flourish, those are positive steps. In my mind, and those are the things that we can and should focus on, because it improves it improves the infrastructure of our public health care system, which is what we have to have if we had a single payer system anyway, a strong public health system.
You talked earlier about the potential for California requesting a waiver in accordance with the ACA. And one of our audience members says, now with Biden as president-elect, could you talk about what actions might be taken by Congress to grant waivers to remove barriers to states establishing a single-payer system? Do you see that actually occurring? And if so, what do you think that process would be?
Go ahead, Bill.
I see President-elect Biden would be more receptive, but also, though, he will have to use some of his political capital to get legislation passed. Because when I designed the single-payer system for Vermont, the governor went to President Obama seeking waivers, but then they found that the waivers require, some portion of it require congressional action. President Obama told him he was not, he did not want to spend his political capital on it. And at least they stalled. And so here I think California has the chance. You're a huge state, the first among equal states, and you can put that pressure on to Biden, and I think you may have a better chance to get legislation passed.
One of the touch points of the ACA that we learned was very important to voters was the elimination of pre-existing conditions as being precluding from buying insurance, and that got a tremendous amount of support. One of the things that voters recognize is the in-network difference in their billing and the surprise bills that come when they go out of network, often not because of any reason of their own, but because of not knowing it. I'm wondering if either or both of you would comment on the voters' experience with out of network and whether this presents an opportunity to get additional support for single payer in the future.
Oh, I could speak for hours on this topic because I'm trying to figure out a way how to get someone to propose legislation to knock this off. It is really awful. So it's not even that somebody makes a choice, Michelle. It's that someone goes to the emergency room and ends up having to go to surgery, and the emergency room physician or the anesthesiologist don't have and will not sign a contract with the insurer, and so that's considered an out-of-network bill, and that patient gets stuck with that bill. So it's not even like someone's making a choice. Air ambulance. I'll just share a story with you. There was a teacher who had twins, and they had to be air ambulance from Mendocino County to Oakland Hospital. And the insurance company charged her $150,000 for that bill. And through the negotiations process and threatening them, we finally got them to pay that bill. But people get these bills all the time, and the hospitals turn people over to collections for these, and they don't know what to do. And this is, as networks are narrowing, there's a lot of work, I know, in the state and nationally on surprise bills to prevent that from happening. But again, it's like the minute you squeeze that balloon, right, it's gonna pop out someplace else. This is, you know, you can fix that problem maybe, but it takes so much energy and time. Why don't we just fix the system instead of trying to put little tiny instead of nibbling around the edges? It's like, we'll fix surprise bills, right? And then those sneaky guys are going to figure out another way to deny you care and make you go through a lot of pain and misery or bankrupt families. It's like, why don't we fix it and stop this nonsense of putting a Band-Aid every time they do something to make us pay more or deny us care?
Well said.
Yeah. So we are coming toward the close of our program this evening, and I want to finish out by giving each of you an opportunity for a closing statement. And the committee has asked that I ask each of you to respond to this question. Can you tell us what you would counsel voters to listen for or pay most attention to as they weigh the healthcare positions of our legislators and our executive leaders going forward? And I defer to the two of you, whoever wants to take it first.
Go first, Bill.
Well, I would advise the voters, one is really learn more of the knowledge about the single payer and what problems will solve, and then talk more openly about they want, like, the pre-existing condition or out-of-network extra charges, these things to be removed. And but that requires a systemic reform. And I would think the educational part, as well as what Cindy said, many assemblymen and the senators don't even have the knowledge. So therefore, they can be swayed easily by lobbyists. So that's why I believe one of the first steps can be done is like what the League of Women Voters is doing now, and what Cindy, your house in California now is doing. I think the knowledge can make us free.
Yeah, thank you, Bill. So I'm gonna, when I first moved to San Francisco, it was, I think I had lived there for 2 weeks when Harvey Milk was assassinated, and in San Francisco. And there were so many grains of insight that man gave us about social justice movements. And one of the things he was saying to to his community is, you got to come out. You've got to come out and tell your brothers, your sisters, your aunts, your uncles, your cousins. You have to tell them you're gay. You have to tell them you're a homosexual. You have to tell them you're a lesbian. Because once you do that, then they love you and they will understand who you are, and there will become more acceptance. And there was a huge push for that as there became more acceptance for rights for people in San Francisco, and now as a nation, much more acceptance, because people came out and said, this is who I am. And I think as single payer supporters, we have to come out and we have to say to our neighbors, and this is a tough conversation because there is so much opposition. We have to say to our neighbors, to our politicians, to our relatives, this is a great conversation to have at your Thanksgiving Zoom table this year, is to talk about the Healthy California is meeting, and here's what's missing, and this is what we need to do. And it's citizen lobbying in a way, and citizen action is the only way that there will be enough power to overcome the type of obstacles that Dr. Hsiao presented us with, saying that's what the real problem is that. And by building a better understanding for that and toggling a little bit with those that we love, and even in our religious institutions, our churches, you know, our clubs, you know, I get into big fights with my family over this, and then we hug when we're done. And I've created a lot of believers because over time they've gotten a surprise bill. They've gotten a 27% increase, and it's like, holy moly, Cindy, I thought you were crazy, but I actually see what you're talking about. And so that's what I think we have to do, and organize ourselves, not just, you know, silly activists like me that have been at this for a long time, but just the regular folks in our community, getting them willing to take that risk, to take that next step, to go in and talk to their legislators, or write a letter, or, you know, join us, right? Give us, it takes resources to make things work. Give us a check and let us, you know, let us fund, you know, some of these projects that we want to do. That's what needs to happen, in my opinion.
Okay, and with this call to action and your closing statements this evening, that will wrap up our healthcare forum. We'd like to thank our speakers, Bill Hsiao and Cindy Young, for guiding us to a better understanding this evening. Thank our audience for your interest and participation, and of course your great questions. We greatly appreciate the opportunity the League has provided to present these forums. We're actively working to provide future forums in 2021. We remind our viewers that this forum has been recorded and can be viewed at our League of Women Voters Davis area website. In this time of increasing COVID spread, we remind you all to continue to observe public health, personal hygiene directives, promote community health, stay safe. Have a good evening. Wishing you all a safe and healthy holiday. And this concludes this evening's presentation.
Thank you so much
for joining us.
Thank you.
Thank you.
Thanks. Thank you.